Communication, in its simplest definition, is the exchange of information from one person to another using any means possible. People with learning disabilities will have difficulty with some form of communication, whether that's a difficulty with comprehension, so that's their understanding of a word or a message, whether it's their processing time being more delayed or taking them longer to remember and store what has been said, whether that's a difficulty with their expressive language, so that's how somebody expresses themselves and formulates a word or sentence, or whether that's a problem with their articulation, so there we're thinking about the individual speech sounds. So somebody might speak but it would be unintelligible or sound slurred or slightly disordered. Their communicative abilities are often either overestimated or underestimated. So an example might be that somebody might have a physical impairment, so therefore their speech is slightly slurred or disordered, and so somebody might assume that their comprehensive ability is also impaired, so they might be underestimated. Alternatively, somebody might speak verbally and appear very able, however their comprehension might be limited, so therefore they might be overestimated, and both of these situations have a negative consequence on somebody's motivation to communicate with healthcare professionals and can also cause communication breakdown along the way. So in 2016, the government introduced the Accessible Communication Standard, which outlined that all health and social care services should be providing information in a way that's easy for people to understand that have learning disabilities, impairments or sensory losses. And this should be followed by law, and it aims to make services have better outcomes and experiences for people with learning disabilities and make sure that everybody understands what's involved in their health and social care. And this applies to doctors, pharmacies, hospitals, social workers, and anybody in that field. Communication methods that people with learning disabilities might use are Makaton sign language, which is signing whilst you speak, objects of reference, which is using physical objects to represent an idea or concept, using pictorial resources such as photographs or symbols to help communicate and understand, also using iPads. There's lots of apps you can get available now for communication, and also interactive devices. And also interpreting things like body language, gesture and facial expression. Firstly, I would say to consider your environment. So people with learning disabilities are more likely to have hearing and visual impairments, and so I guess it's making sure that your environment is well lit, that you've reduced background noise, and that you're sitting at an appropriate distance for somebody to be able to see your face clearly and read those extra cues that you might give with your face. If they have got a hearing or visual impairment. If they do have glasses or hearing aids, making sure that they're clean, that they're turned on and also regularly reviewed. Secondly, allowing some processing time. So people with learning disabilities may take longer to process the information, so it's about making sure that you're giving that space for somebody to process the information but also to respond. So ensuring that if somebody hasn't responded, you're not straight away repeating the message, you're allowing that time and not assuming that they haven't heard you or misunderstood you, but they might actually still be processing what you said originally. So for people with learning disabilities, with that extended processing time, it's going to take them longer to register your message. So speaking in a slow and steady pace and emphasising the key words in the sentence will be really beneficial. Keep your language simple and short, so when you're speaking in sentences, making sure that they're concise and very clear. Your choice of language should be everyday words as opposed to medical jargon or terminology. An important thing to consider is that words can be context specific as well, so something that you might use every day in the hospital might have a different meaning for somebody with a learning disability that hasn't applied it to a different context. So an example could be if you were saying we're about to go into theatre. In a hospital, that would mean that you're going in for an operation, but for someone with a learning disability, their understanding of the word theatre might be going to see a West End show. And so it's very important to make sure we're being very clear and direct with the words that we're using and considering the other meanings that they might have for that person. So often we use abstract phrases or metaphoric language in our speech. For example, the doctor's doing his rounds, or you've been through the wars, or terminology like that. And for people with learning disabilities, they might take that literally. And so it's important that we instead use literal language instead of more abstract themes. Lastly, using a total communication approach. So thinking of all of the different ways that you can communicate that message to the person, having a pen and paper available, writing it down, drawing it, signing it, getting the physical object and showing somebody, really thinking outside the box of all the different ways that we can promote understanding for the individual.